If you're curious about bioidentical hormone replacement therapy for perimenopause and menopause, and you've been wondering about the difference of FDA approved versus non FDA approved options, which one is best and which one to choose, then this Wild Wisdom Show episode is for you. Hi, I'm Dr. Patricia Mills, a holistic medical doctor with a root cause approach to health. And today we're going to be talking about FDA approved versus compounded bioidentical hormones, understanding the differences and choosing the right option. Now, when I go onto the internet and I look at the questions that women are commonly asking, one of the questions is, why are bioidentical hormone for hormone replacement therapy not FDA approved? And the answer is that that's not true, actually. There are bioidentical FDA approved hormones, and then there are bioidentical non-FDA approved hormones that are different and might be a right option for you depending on your circumstances. So let's unpack this a little bit more. So bioidentical hormones in a nutshell look exactly like your hormones, and they have been proven to be safer in terms of decreased risk of breast cancer and other issues compared to non-bioidentical hormone therapy. This is more recent research. Your family doctor or your regular doctor who prescribes hormone therapy may not even be aware of this if they haven't been keeping up with the more recent research. But let's just agree for now on the fact that bioidentical hormone therapy is what you want. And the question now is, do you want it to be FDA approved or compounded? And let me explain the difference for that. So FDA approved hormones, whether they're bioidentical or not bioidentical, are made by a very large company. You could call it big pharma, for example, very large organizations that have very large manufacturing plants where all the hormones are made. And because they are centralized to be made in these big manufacturing plants at very specific doses with always the same ingredients made in the same way all the time, the government can send inspectors into those plants and manufacturing places and inspect the process and ensure the quality of the process. Now, there are still issues with these hormones, and sometimes there can be recalls of products, and that's the case with any medication. But generally speaking, the risk is lower when you know that that facility has been inspected by government agencies. And so government can say that these are FDA, Food and Drug Administration approved hormones, okay, because they've been made by these big companies. Now, that's the pros, and oftentimes as a result of being FDA approved, they are covered by health insurance if you have health insurance. So while FDA approved medications can actually be more expensive than the alternative, which is compounded, I will explain what that is very shortly. Because they can be covered by health insurance, for some people, it's actually cheaper in the sense that they're not paying for it completely out of pocket, 100% out of pocket. So that's the FDA approved options. And again, you can have bioidentical FDA approved options like Prometrium is a bioidentical FDA approved progesterone therapy. There's the estradiol patch and estrogel, which is the estradiol gel. There's also estradiol vaginal options. There's the crinone, which is the bioidentical progesterone vaginal option. So within the scope of FDA approved, you actually do have bioidentical options. It's up to your doctor to know that those are available and to choose to prescribe the bioidentical options within the FDA approved options and not the non-bioidentical options, things like Visan, for example, or the conjugated equine estrogens, which are the ones like Premarin, which are frequently used in things like birth control and that kind of thing. So that's the FDA approved. Then the other option is compounded. Now, compounded is used by people who are really deep into hormone therapy, and they're trying to what they're trying to do with the compounded therapy is to have more flexibility with the dose. So whereas the company that is making the big pharma is making these very set doses, so a set dose in the patch and a set dose in the gel and a set dose in the pill, the compounding can actually create more diversity, so you can get smaller doses all the way up through to larger doses. So someone, for example, who may not do well with a certain dose of Prometrium, which is an oral micronized progesterone, they might do better with a compounded oral micronized progesterone at half the dose or a lower dose. Compounded means that a local pharmacy, so like your local pharmacist, is making that, compounding it in their pharmacy. And because they're making it in their small local pharmacy, the government can't send inspectors to all of these pharmacies to ensure best practices. So then those compounded products that are made on the spot are not FDA approved. Now, interestingly, when you go in and you buy like, certain kinds of antibiotics or medications, sometimes they are compounded in the pharmacy. So there are pain medications that are compounded in pharmacies. A lot of pain doctors will use them. So it's interesting because this compounding thing has been around for a very long time. And it's the idea of mixing what you want in that moment at the dose that you would like with the ingredients that you would like. The second reason that doctors will use compounded medications is because perhaps the patient has an allergy or reaction to one of the ingredients in the FDA approved options, so that they'll ask the pharmacist, please make this without this product, right? Added in so the person doesn't react to it. So that's the second reason why a doctor might prescribe a compounded version versus an FDA approved version. So the first is you get more personalized tailoring of the dose. The second is you can avoid certain ingredients that you don't want in it. And then the third reason is that you're actually having to pay out of pocket for these hormones, and compounded is actually cheaper than the FDA approved. So when you get a compounded medication made in the pharmacy, you can actually pay less if you're paying for it out of pocket. So again, when you have health insurance, FDA becomes cheaper because it's covered by health insurance. But if you don't have a health insurance, you're paying out of pocket, the compounded options are cheaper. And then the last reason that doctors will use the compounded version over FDA approved is that compounded versions have more flexibility with adding in different kinds of estrogens like estriol. So we have 3 different kinds of estrogens in our body. Estradiol is the main one. Estriol is a milder one that is less potent than estradiol by about 4 to 7 times less potent. And that's the one that's primarily present in pregnancy. And then there's estrone, which is the one primarily present in menopause, again, not as potent as estradiol. And so there are formulations where you can actually mix a bit of estradiol with estriol to get a gentler effect. And some women who are, very activated by estradiol, they might actually, it's not enough to go down on the dose. They might actually prefer or do better with estriol added in. And there's different, when you're compounding, you can do 70% estradiol and 30% estriol, or flip that to 70% estriol and 30% estradiol, and everything in between. So it allows more tailoring of the dose and responding to the body's needs. So for example, you, depending on what, how you're showing up to your prescriber, if they're very versed in bioidentical therapy, the conversation might start off like saying, okay, we're going to use bioidentical. Here are your options, FDA approved and compounded. If it's financial, do you have health insurance? Because then, the FDA will be cheaper. You say, yes, I have health insurance. And then you might start with the FDA approved options. But if the FDA approved options end up being not appropriate dosing, or you have allergic reactions to the components, then over time you might delve into the compounded options. Now, the pros of the compounded I've talked about. The cons, the negative things about the compounded is because they cannot be inspected by the government, you don't know if that pharmacy is producing it under good quality practices. And so one thing you can do is make sure that you've actually gone to that pharmacy and you've spoken to the pharmacist. You ask them about, their experience with compounding. How long have they been doing it for? Maybe you could even ask for a tour of the facility in the back just to see how it's made. The government sometimes has said things like, oh, we're surprised when we go into certain pharmacies and it's like dirty, or there's the dog bed for the pet right beside the generator for the, for the medications, whatever that might be. As long as you're comfortable with the quality of the work in your pharmacy, then that pharmacy becomes an option for compounding. And is there a risk of that, the dosing changing, or there being issues, compared to the FDA approved options? Yes, there is, but maybe that's a risk that you're willing to take if either you're paying out of pocket and you need the cheaper option, or you're not responding well to the doses or the ingredients in the FDA approved option. So I hope that this helps to clarify this issue. If you're listening to this in a podcast, pop over to YouTube if you have any questions and put it in the comments for this video. If you're watching this and you have questions, please put your questions in the comments. I'll come back and take a look. I'll answer them, and it'll also guide me in terms of any future shows I need to do on this topic, because we need to make sure that we're very comfortable and speaking the right language when we're talking about hormone replacement therapy, because we are all confused as it is, like the general population when it comes to this. And let me tell you, your family doctor, like your typical family doctor and your gynecologist that has not received additional training in hormone replacement therapy beyond their residency training, beyond their medical specialty, this requires additional training. So, for example, I did functional medicine certification. That was additional training. I've also created the training program for the nurse practitioners in an online company called Science in Humans that provides online services to Canadians using nurse practitioners who have been trained in this by myself, and also have their own individual certifications. The North American Menopause Society is training physicians as well. But this conversation about bioidentical versus FDA approved versus compounded, we need to really get clear on this. Also, if you're wondering about natural versus synthetic, you'll want to look up my the Wild Wisdom episode speaking about bioidentical versus synthetic options, because you need to understand that as well to be able to go to your doctor and very clearly explain to them what it is that you want. And what I would recommend is, at the very least, the common denominator is that it has to be bioidentical. And again, there are bioidentical FDA approved options, and pretty much all compounded options are bioidentical. So when you're getting compounded, it is bioidentical. When it's FDA approved, it could either be bioidentical or not bioidentical, and you want to stay away from the not bioidentical options, no matter what your doctor tells you. If they say it's okay and it's not an issue, they're simply not up to date with the more recent research findings. So I hope you found this helpful. Please share, save, and subscribe. Sharing is caring. You never know when someone might benefit from this wild wisdom. And I look forward to seeing you at in the next episode. And I hope you have a wonderful rest of your day, evening, or night, depending on when you catch this. Bye.